So the next item is the school reentry update, as we have been bringing to you at every board meeting. So I'm going to invite Mr. Matt Anderson to do the presentation for you. And we ask that you accept it as an informational item, so there is really no action to take afterwards.
Good evening, President Lopez, Vice President Brownlee-Page, board members, and Dr. Miguel. Happy New Year. It's January. Can't believe we're already to this point. But tonight you'll be hearing from a variety of department leaders on their efforts to help with the reentry of staff and students, as well as a tentative plan for a next phase of bringing another group of students into our buildings. Once the presentation is complete, we're going to take any questions that you may have. And so to get us started, I'm going to have Miss Elizabeth Morris begin by sharing just a little bit of update around our health services.
Good evening. So I'd first like to provide you with an update on the data surrounding the spread of COVID in Wyandotte County. And so as you can see, this is the Wyandotte County COVID scorecard, which reflects a 7-day snapshot of the state of the county. And so this scorecard reflects the dates of December 28th through January 3rd. And you can see that it shows a average daily number of cases at 97 with an average percent positivity of 40%. So as part of our strategies for combating the pandemic, we are working very closely with the health department on a daily basis, if not multiple times throughout the day. One of the things that we were able to coordinate with the health department prior to the holiday break was a staff COVID-19 testing opportunity. And so we were able to have a COVID testing location set up so that staff could come, take a saliva test, provide a specimen and turn that back in and have test results within 24 hours. And the health department and I felt that that would be very valuable to our staff going into the holidays, so they would know before they gathered with families, what their status was. And so we were able to test approximately 130 staff members over the course of 2 days prior to the holiday. We're currently also working with them on a vaccine coordination schedule for staff. Some healthcare workers, within our district have been able to receive that vaccine. So that has included our school nurses, as well as OT, PT, speech language pathologist, and school psychologists. And then they're getting ready to expand that to social workers and a few other groups that fall under that phase 1 healthcare worker category. We've also been able to receive test kits from the health department for any students who present with symptoms. So because we do have some students in buildings, if we have any that present to the nurse with symptoms, they would be able to provide a test or be provided with a test before they are picked up and sent home. And then again, we would be able to have rapid results on those as well. One of the important elements of mitigation with the reopening of schools is being able to perform timely contact tracing. And so part of our policy since even through the summertime was that any staff member who presents with symptoms or has been exposed would contact their supervisor and then would have to speak with the nurse prior to being able to return to work. And so in the month of December, we had 180 staff members who either were symptomatic or had been exposed. And of those 180 contacts, 65 of those did end up testing positive. You had asked for some more data on that, and so I was able to provide that 30 of those 65 were certified staff, 35 of those were classified staff. And then in November, you can see the number was 228 staff who were either symptomatic or exposed. 70 of those tested positive, with 36 of those being certified staff and 34 of those being classified staff. And then as far as an update on nurse staffing, we are still able to staff the buildings that do have students in them at this time, but we do still have 2 nurses who are on FMLA through the end of this school year. as well as 2 nurses who are able to work a part-time schedule based on their FMLA. Additionally, we have 6 nurses who have requested accommodations, 1 for medical reasons, 5 related to childcare. And then we still have 8 vacancies. 3 of the schools that have vacancies do not have any students attending at this time. The other 5 schools that do have students attending, we've been able to staff those with either substitute nurses or other nurses that do not have students in their building.
Thank you, Elizabeth. Next, we're going to hear from Ms. Kelly Tushman and give you a brief update on accommodations through the Human Resources Department.
Yes, good evening, board. Just wanted to remind you kind of where we were with accommodations. We've talked about this a couple of different times. As you recall, we sent out a notice end of October and asked for our employees to let us know if they were going to need an accommodation. This was in anticipation that we would be going back to some type of hybrid model or full-time school at the first of the year, towards the end of the year or first of this year. And we did receive quite a few requests, of course. The accommodations that I show over here on the left-hand side of the chart is really related to the accommodations for certified staff. We also received and continue to receive accommodation requests for also classified staff. And so I think this number was somewhere around 140 for the certified at, as you can see, a lot in elementary and high school, and with some being in the middle school as well. So this is kind of where we were. We're in a kind of a pause at this point because, of course, we have not, our new scheduled date has been to return to some type of hybrid model in March. And so at this point, we have not needed to make accommodations because we're not back in a school setting at this point. Now, the only times that we have had to make accommodations is if we are returning students sooner, such in the case of some of our SPED students, ESL, and those limited cases where we brought students back. Otherwise, we're, like I said, in kind of a holding pattern and not making any type of accommodations at this point until we know kind of what, when we're going back for sure and how we're going to basically scale into whatever kind of a hybrid model we go with. So that's just to give you an update on kind of where we still stand with accommodations.
Thank you, Ms. Tushman. Next, we will hear from Ms. Lisa Garcia Stewart to give you an update on our learning mode results. We asked parents to complete a survey selecting which mode of learning they would like to receive when their students return to school in April. So I'll let Ms. Lisa Garcia Stewart give you an update on those.
Thank you. Good evening, President Lopez, board members, Dr. Miguel. Thank you, Matt. Our numbers that we want to provide and share at the board that are updated are the number of requests we have for reentry for our students, which are 9,159. And for the parents that opted for their children to remain in remote learning is 7,635. And our enrollment is 21,334. So there are 4,540 students that will fall into the hybrid number, but we're still going to continue to do everything we can as we move forward to solidify our plans to make sure that schools are reaching out to those remaining students. Thank you, Matt.
Thank you, Ms. Garcia Stewart. Next, I will have Dr. Jaquita Lowry discuss where we are with our special education reentry updates.
Thank you. Good evening, board, board president, board vice president, all of the board members, and Dr. Miguel. I'm here to give you a brief update on our reentry for special education. Before I start, I just want to acknowledge and say thank you to our special education teachers and paraprofessionals who have been back in person providing services to our my students with high needs since December. I've enjoyed visiting these schools and seeing a lot of the things that have been put in place for mitigation and instruction. So I just wanted to take a moment to say thank you to our special education teachers and paraprofessionals. As it says on our screen here, phase 1 returned back December 7th. Yesterday was our first day for returning students for our phase 2. That's our CELS 2 and our CELS 1 program. And the information under that is to try to give you some numbers on how many students we are currently serving. So we have about 125 students being served, 22 teachers that have come back to provide these services, 35 paraprofessionals that are working within our classroom supporting the teachers and the students. As it relates to the initial evaluations for our school psychs, we started bringing students in on an appointment basis to test for initial evaluations, and we're now at 132 students that have been tested. Our next steps is to bring in a phase 3, which is our behavior support classrooms. That is one of the areas of high needs that was discussed early in this process. And so now we want to start looking at those students with a tentative date of February 16th. We are going to be adding 4 additional schools that will have students. That's Wyandotte, Mark Twain, Carl Bruce, and Argentine. We have had our staff call parents over the past few days to see which ones are still interested in coming back for in-person services. And so far, we have had 39 parents have elected to send their students back to begin receiving services. This is still a work and that we're work in process. We still need to work out a few things on how we're going to serve these students in the program for BSC, as some of them do receive general education support. But this is our next steps, and this is the next group of students that we're looking to bring back and serve and support.
Thank you, Dr. Lori. Next, you will hear from Ms. Jacqueline Rodriguez on our ESOL reentry updates. Ms. Rodriguez, I think you're on mute. Sorry.
Thank you so much. Good evening. Just a couple of updates for ESL. We are continuing with our 3 sites at Eugene Ware, Central, and Washington. Students have now begun attending 4 days a week, Monday, Tuesday, Thursday, Friday, and the next step for this group is to increase their services to full day. The teachers have been able to really connect with the students, and they're seeing that follow through with the afternoon connection of students, as well as rich language growth. And then we will be bringing in students for that are currently on the wait list and being recommended for the ILC. Again, that's the Intensive Language Center. That's for students who have some sort of interruption or lack of formal education. And then we have our group of newcomers, and those are the students that have been in the United States for less than a year, and we're continuing to work on plans to support these students. And then part of that looks like meeting students at buildings to get connectivity with them, supporting with the language, and then also continuing enrollment. We have an increase of students enrolling, and then for the district as a whole, we've continued with our pre-screening testing this week, and we are pretty close to having all of our students tested, which is to maintain compliance with the state, and this is on individual. And then we're finalizing plans for our district-wide CALPA testing, as the state hasn't given any flexibility with that. So we're looking at 9,000 students that we will need to bring in for an on-site test, as it must be proctored within a building. That testing window begins February 15th, and we are continuing to work with transportation and buildings to create a plan that supports bringing back that large number of students for that testing window. And that concludes the update for ESL.
Thank you, Ms. Rodriguez. Next, we'll talk about our proposed next phase of a student return. As you all are aware, on December 1st, the board made the decision to postpone the return of all students to in-person hybrid learning until April 5th. As we continue to provide remote learning services, we understand that there are a group of students that are still vulnerable to falling further behind due to not receiving those in-person learning services. And so the first phase of this student return project was to bring in students who needed the most intensive special education and ESL services, as was shared by Dr. Laurie and Ms. Rodriguez. Moving forward, we wanted to ensure that we continue to plan for bringing in the next phase of students who might be at higher risk of not progressing. So therefore, based on the information that we've been receiving from the health department, we wanted to begin thinking about which student groups would be best to bring in our next phase of in-person learning services. Our main focus, as you can see on the screen, is that we will focus on K-5 students. And we know that based on the data that was shared by us or shared with us by the Wyandotte County Health Department, the spread of COVID is not as prevalent in our younger students. With that, we also want to consider bringing in a group of seniors that are not on track for a possible on-time graduation. And we want to make sure that they get the services necessary to be successful to be able to graduate. So as you can see, we have a group of students listed here that would begin on February 22nd. And based on their circumstances and where they are in their learning progression, we would encourage or recommend that we bring these students in 4 days a week. That would be Monday, Tuesday, Thursday, Friday, Wednesday being a clean day. We know that we currently have a group of students in kindergarten through 5th grade who are unable to connect. Based on a survey that we sent out to our building principals, we have approximately 300 students in K-5 who are unable to connect even with the district provided hotspots. One thing that we want to do is not all students are going to be selected. So we are focusing our efforts on those that have chronic absenteeism, which would begin from the beginning of the year until December 18th. We're also looking at students based on grades and assessment data that are considered high risk for not progressing and falling further behind. As Ms. Rodriguez mentioned, we'd also like to bring in a group of K through 5 ESL newcomers. And as mentioned, those are those students that have been in the country less than a year. Dr. Laurie would also like to encourage us to bring in a group of K-5 students with high IEP minutes, individualized education plan minutes, knowing that they need some in-person services to catch up. We also have some students, K-5, that are considered in foster care. And so we would work with the Avery Village Group Home, as well as KVC, to determine which foster care students would best receive these services. We also have some students, K-5, that are also facing homelessness. And so therefore, we would like to consider bringing them in as well. And then finally, as I mentioned, bringing in a group of seniors who are not at risk or who are at risk of not graduating on time. And so how can we make this happen in the next few weeks? First, we're continuing to move forward with working with building principals to identify the students who meet this criteria listed on the previous slide, as well as making sure that we look at their forms that the parents submitted to ensure that they do want in-person services based on that learning mode survey. We're currently working with our principals and HR to determine which staff would be needed to support in-person learning within their buildings. To allow for time to plan and prepare for in-person services, we would recommend that any identified staff would return 2 weeks prior to students returning on February 22nd, which gives us a start date of Monday, February 8th. So it gives us about a month to make sure that we have the right people in the buildings on that day. As I mentioned, we would have our Student Services Department collaborate with KVC and Avery Village Group Home to determine which students are struggling with remote learning and may be falling behind or absent due to their circumstances of being in foster care. And then Student Services would also help us work identifying those McKinney-Vento students that are considered homeless. We also know that nurses are essential in ensuring this safety of our students. And so Ms. Morris is working diligently to guarantee that we have nurses in our buildings so we can make sure students are safe. And then finally, we've been working with Miss Lenora Miller and her team to determine how we can get transportation and nutritional services that are needed to make this phase happen. We know that with any kind of return, there are always questions about what safety measures we have in place. Just as a reminder, in September, we shared a document with the Board of Education called our KCKPS Safety Return Plan for Students. I will share this document with Dr. Miguel, and she can share it again in her Friday message with you all board, so you have a copy of it. But in this plan, it includes all of the safety requirements that we have as a district, and each building then created a plan for their building based on those requirements for their specific buildings. And so here are just a few of the items on this slide that were addressed in our plan of return. Just to make sure that everybody knows, when students return, there will be desks in the classroom that do have shields that are installed. We will also have the classrooms designed to ensure that we have that physical distancing that's required by Wyandotte County Health. We will have temperature screening protocols in place, and they will need to be completed prior to staff and students entering into the buildings. When it comes to breakfast and lunch protocols, breakfast at all sites that have students will be a grab and go when students enter the building. And then lunch will be in the cafeteria with physical distancing. And then there will be cleaning between each of those lunch periods. There was a question regarding mask mandates. We will mandate the use of masks based on the Wyandotte County mask mandate order, and it will be followed by both students and staff. And then finally, K-5 students will still have recess. According to CDC recommendations, masks are required. We're going to do our best to ensure that students are trying to social distance during that time. But if there isn't that capability of the best social distancing, we're still cohorting students, so they're still part of that group, so they don't spread within their groups. As we continue to move forward, we want to continue to plan ahead and think ahead to another possible phase. And so, as you know, we really focused in on that K-5 level. In this level that we would like to think about for our next timeline would be a tentative start date for a lot of our secondary schools, so middle school and high school, as well as early childhood. This tentative start date for students would be March 22nd. And that tentative start date for a phased-in approach for teachers would be approximately 2 weeks ahead, which would be March 8th. And it gives them 2 weeks to get prepared for students and staff. So this is the end of the presentation. I know there are probably lots of questions. We know that when we do anything with reentry, it requires everybody to be on board. So we are all here to answer any questions that you may have.
Thank you, Mr. Anderson, and team, everybody that presented today and has put so much time and effort into the presentation. So I do want to open up for questions from board members. I'm sure there are plenty. I do just one quick question regarding the possible next phase timeline in terms of the students returning. Are you also thinking some of those same groupings that you're that will be coming back in terms of at risk, those students who haven't connected, or is it a little more flexible for that possible next phase and timeline?
If the board would deem it necessary to bring in even more students, we could work through that. Currently, what we have is those students, those high-risk students that I will go back to this slide here, and I want to make sure I'm answering your question, Mr. Lopez. This does include a lot of...
I think the question is about the March 22nd phase. Is that correct?
Yeah, but that's also a great segue. So for the March 22nd
yes.
potential return, are you still looking at these same groupings of returning students and not the entire population?
Yes, okay. Yes. So, and it would be similar to the same criteria that we have set here, but it would be for the middle school and high school levels. So we're looking at bringing in smaller groups of students at this point.
Okay, thank you. Yeah, that answers the question, but that does touch on you know, if the board were to think about increasing or expanding the phase of student return beyond these groupings that you've presented tonight, what would that look like potentially? And so that may be beyond your scope to talk about tonight, I understand, but I'm just curious if that's been something that has been discussed.
We have been in discussions, and Dr. Miguel, if you want to chime in, you can. But yes, we worked on a smaller proposal first, just to make sure we get these high-risk students. But we have also been in talks with phasing in levels of students. So bringing in our youngest students, EC2, and then bringing in a 3-5, and then a phased-in approach, if that's the way the board would like to move. Dr. Miguel, would you like to share?
Well, I was just going to add that for this phase that we have on the screen, because we have identified the highest need students, those students who have fallen really behind due to lack of connectivity, we were going to match the schedule that ESL and special ed has, which is 4 days a week. Originally, if you remember, the plan for students to come back in January was in a hybrid model. So half of the students would come Monday and Tuesday, all remote on Wednesday, and the other half of students would come on Thursday and Friday to maintain social distance and be able to mitigate. So because this is a smaller group of students, we decide and we assess that they need very intensive support due to the loss of learning. We are planning to bring them in for 4 days a week. But if the board approved a return of all students earlier, then we would go back to the hybrid 2 days a week, 1 day of all remote, and then a different group 2 days a week, which is the hybrid model we had initially approved.
Thank you. I didn't mean to get ahead of myself, so I apologize.
No, that's fine. That's you know, and like Matt said, we have been having conversations of both models. So we are welcoming any suggestions and different proposals from the board.
Dr. Miguel, I have a question observation. I've been reading quite a bit, and Dr. Watson has mentioned several times in his presentations that they're very concerned with the K through 3.
Well,
The very early elementary students.
As are we, and lately he has expanded the grade level span to, he calls it K2 elementary, because he knows some school districts have elementary that is K5 or K6. So he has actually been very vocal now about elementary students being past the 3rd grade.
Yeah. So that seems to be the ones that they were really concentrating on, and then our seniors.
Yes, and that's why we have what you see on the screen also, identifying seniors. We know this, you know, they are out of time, right? If they want to graduate on time. So that's why we included that group.
Are we looking into any type of summer programming?
Yes.
With the money that's supposedly coming down from Washington?
Yes, we're very excited. We had a preliminary announcement, nothing formal yet, and nothing that we can share with the board formally, but we have had some sharing of communication of additional funds coming with the purpose of addressing the loss of learning in all students. So we are already forming a committee of staff to start brainstorming the best way to use those funds, with the clear purpose of accelerating learning and recovering from the loss of learning.
For all students, not just a certain.
Correct. Understanding that we cannot make students attend summer school, but the goal is to offer it to everyone who is willing to attend.
Okay, thank you.
So we have different models in mind, and we will share once we know for sure that we're getting
right. Yeah, we got to wait to have the funds first before we can offer it. But
we started planning.
Okay, thank you.
Thank you.
This is Yolanda, and I just want to piggyback. So thank you, Jamie, for asking that question. That was definitely one of the questions I had about summer and for all students. And then my second question, and I don't know if it's appropriate or not, so just stop me if it's not. I'm hearing us say high risk in the beginning, and mind you, my filter is different than those of you that have a strong filter in education. Are there any concerns with privacy there, like the students understanding and knowing why the other, not necessarily directly, but just privacy in that first phase?
Well,
does my question make sense?
I think I understand what you're asking, and we're not labeling students as high risk.
Okay.
We are looking at who are those students who have either not connected at all or had connectivity, but they have chronic absenteeism, which would be a high risk in normal times. We would address that in normal times. So we're looking mainly at participation and connectivity, which results in that high risk of not progressing, because if you're not showing up to school, even if it were in person, normal times, no pandemic, we would be knocking on those doors to say, hey, your child is at risk of not meeting the goals or not progressing. So it's not a label that goes in the record. It's just how we are realizing this child has not been in class for however long, until December 18th. They have not shown up at all. They have not connected. That is in itself high risk.
Okay, and I completely support what's happening. Again, I deal a lot with like privacy and on the other side. So I was just wondering about the first phase and how we are, I'm going to use the word label, it may not be appropriate. Those students, we're bringing you back for these reasons. And so just the privacy of understanding why a student is back.
Mm-hmm. Sure, thank you.
This is Wanda Brownlee Page, and I want to start with health. And I was at the meeting last Friday with the health department. Little confused because to me, they made some conflicting statements. What bothered me the most is that we're at 38.6% in the county. Because when you look at the news, they always say we're fourth and Johnson County is ahead of us, but somehow we always seem to be at the head when you hear it another way. And my biggest issue when we went to the legislative meeting, I heard the people from Piper, their screening system to me was much better than what we offered in terms of and if she didn't say it right, she said it. She said that they take their temperature, and at our meeting with the health department, the young lady said that wasn't a necessary thing that you do. But when I've taken people to KU to the doctor. I couldn't go in. They took their temperature. When I go to the doctor personally, they take my temperature. So the young lady was saying that was something that we didn't need to do. But it seems like different organizations and businesses still do it. So I hope that we wouldn't stop doing.
Yeah, we are
with that. I thought that was a little off the mark.
Yeah, we are planning. Sorry, Miss Page. Sorry, I didn't mean to interrupt.
But if we make sure that we take temperatures, she said they had kits. I heard Miss Morris say they had kits, and the lady said they immediately, if they find out something's wrong, they give them the test. They had a courier who takes the test to the health department. They seem to have a pretty aggressive system. So if we're doing this, then that's what it's going to take. And then those screeners that we paid all that money for, they need to work. And then we still have 8 vacancies. She said 3 schools, there were no kids, 5, we have sub nurses. So it just makes sense. Somebody has to do this paperwork, and we need to make sure, because we just can't be haphazard, because that to me creates a problem. And then on accommodations, I know Ms. Tishman said that right now she gave the numbers, but why would we wait? You know, you're talking about bringing people in. I don't know who knows who's coming in or what, but you would think they would know whether it's been approved or not. And do the principals know? Do they have that information? People have requested. Has it been accepted? And it just seems like if you wait, or maybe I don't know, it just seems that's dragging. You need to have that done. And do they have the second semester schedule set up where people know what they're going to teach and how the classes and people are plugged in? And if it's hybrid, Matt, you said it one time, because I expressed the concern after talking to teachers in Olathe about hybrid, how some of them struggle with the group in and then the group at home. And you had mentioned that wouldn't be the case. So are we clear on who's doing what? Because if we don't know who's being accommodated and who's where and who's what, who's doing what? And do the principals know? And how soon will they know? Or how long are we going to wait? Because it doesn't make sense to wait. If the people are put in, then when do we make the decision? And what is the criteria? Because I asked the question before we got here, so I'm not just surprised. What is the criteria for accommodation? Who gets it, who doesn't?
So,
And I didn't hear anybody address that.
Ms. Page, this is Kelly. So accommodations are fairly tricky because people ask for accommodations for a lot of reasons. And so that's why I'm saying things can change based on when we ask people to come back. So initially there's a lot of fear, right, with COVID, and people ask for accommodations because they're fearful, they may be having anxiety. We ask them, we have a process that they go through. We ask them to provide the documentation on the accommodations that they feel like they need. And we ask them to then support that with whatever medical doctor statements they have. Now, sometimes people do or do not provide that because not every accommodation is something that the doctor is going to request. Sometimes it's because they have childcare issues, or sometimes it's because they're caring for a relative. And so, or they're just fearful of taking it home to their family. So there's a lot of different reasons. And until you tell a person specifically when they're coming back to work, then it's really hard for us to plan for something that may or may not be necessary. Okay. So we have to kind of know when we are asking certain teachers to come back or staff, because then we then have to then get into motion on, now how will we cover this if we are going to ask K-5 to come back across the district. But if we're not asking middle school and high school to come back, then I don't have to deal with those requests. And so it does make a difference. And so that's why I say we are looking at them all, we are working on them all, but we're not granting any of those unless there is a reason for them to come back to the workplace. And some of the things that could change additionally is you think about vaccinations. So if people get vaccinated, they might feel a lot better about coming back to work, right? Because they'll know, like we're planning right now to provide vaccinations for a lot of our staff. Once that happens, that could change a lot of things. So that's my point in saying that there's just so much that we can do until we know the date that we're going to bring people back. And we will work that, as you see, on most of the scheduling information that we put out there. We'll say that we want the teachers back 2 or 3 weeks prior to when we bring the students. And that's for us to have enough time to work through all these issues. So we have plenty of planning that we build in based on when we're going to roll students back in. Does that help provide?
Well, the thing that would, if I were an administrator and we said April, then we have the right to change. Circumstances change, but it makes it harder because you got to get your schedule. You would hope, I'm saying hope, that they set up the second semester schedule because we're in the third 9 weeks. Yep. And that should be set up, but I just said you would hope. Mm-hmm. So you got to know where you're going to place the people and make sure if they're willing to come back, that I just don't want us to be last minute. And
Yeah,
if we're
no,
gonna do
I
it, we got to
understand.
plan ahead. I hear what you're saying. There's a lot of different scenarios, but just don't want to be last minute doing things. And then when I talk to principals and stuff, that's what they're worried about. The scheduling, is it set up? Who do we know? Who's coming back? Who's not coming back? And you're trying to plug it in. And I just feel like that's undue stress for them. It's undue stress for everybody. This is something new. It's something different.
Right.
But you just want to make sure people have time. And that screening is critical. Because if we're at 38.6, and with the other two mutations of it, even though they say, oh, no, that's not a problem, you just get too many conflicting views about whether that's going to, and we still haven't felt the New Year's thing. You know, we're going through the Christmas thing, but now we got to feel what happened with New Year's, which brings me to with nutrition, busing, and janitorial service, the problem with the cross infection with that. And how do we work on that and deal with that issue? Because that's another issue. Because once you say COVID money is up, then how do we deal with people coming to work and we know they're sick? So that's why it's so critical that we have the nurses, people are checking, because people are afraid. They need their money. Everybody's in trouble. So it's kind of scary.
No, I hear everything you're saying.
So, Ms. Page, regarding the screenings, we have the temperature checking devices in all of the buildings, and part of the plan is that every person that comes in the building will have to use the temperature check. We know that not everyone who is sick has a temperature, but at least we will be able to identify those who have a temperature and check. I will have to defer to Ms. Morris about the tests, because we were not sure that the health department was going to have those on an ongoing basis. But I also wanted to share that we are already scheduling the times and locations for the vaccines, and we had over 2,200 employees respond saying they were hoping to get the vaccine. So we will have 3 different sites, and we are working with the health department. So all of those procedures will help us get everyone gradually in as safe as we can. And of course, masks will be worn. We will follow the guidelines of the health department that recommends not only cohorting students, but also having them in small groups. And then each group, you heard that on Friday, each group is at least 6 feet from the other group, so that if a student gets the virus, we don't have to send everyone home, but it's just that cohort. So we're carefully following the guidelines of the health department, but the health department themselves are the ones who are coming to us to say, based on the data that they are seeing, we know that the data in Wyandotte County is very high, but they also said part of the reason why it's so high is that currently they're not testing as many people as they would hope, and that those who are being tested are mainly those who feel sick. So of course, then the percentage is going to be high. And based on the data from Piper, Turner, and Bonner, who have had kids all along, they have realized that the spread is really not that high among students. And that's why they came back to us to say, we know that we were very much against bringing kids in, but we are rethinking our position. And that's why we had them present to you.
Okay, well, I want to go back to the legislative meeting, because it bothered me that the health department provided them tests, a courier to pick the test up.
They did the same for us. They did the same.
They are going to do that for us. Now,
That's what I'm saying. I'm not sure that they will have them on an ongoing basis. Remember in December when we offered the tests for any employee who wanted to pick it up and take the samples, like Ms. Morris, that was part of that, of those tests that we had access to. We did not get to use them like they did because we didn't have students, but they did exactly the same thing. They brought the tests to us, people did the sample and put it back in the box, and then a courier came and picked it up.
Well,
That's
is it
exactly the same
possible
thing.
to check? Because I think we need to offer that.
Oh,
Because
we want to.
give 100% and make sure people are tested, and we're checking. And if they offer the courier, because she talked about all they had that they offered, and then the lady from the health department said they needed 2-ply masks, the cloth or the surgical mask. Who's supplying that?
And I asked the health department that question, and Dr. Corribo, who is the doctor who was presenting to us on Friday, said she's looking into that and will let us know if they can provide masks. But that's a conversation that we are also having. You know, how are we gonna provide masks for those students who do not wear them? But rest assured, Ms. Page, if the tests are available and the service is available like it was up until December, we are not turning anything away. Anything that's going to make staff and students safe, we are accepting it by all means.
And then my other question, okay, we're saying masks are mandatory.
They are
What
mandatory.
happens when a student refuses to wear a mask and an adult refuses to wear a mask? Where's the policy? I didn't see a sample of that. You know, we need to know, because we live in it. When I taught, no didn't mean no.
Right. and
we had rules, but it didn't apply, and it wasn't consistent. And this is a life or death matter. So
exactly.
Where is it written? Do we get to see a copy? Where is it at? Because by now we should have something. If a student says,
well,
no,
and we don't write policy. So we would have it in writing, in communication to staff and to parents, and we would have the same consequences and the same procedures that we have when a staff member or a student breaks any of the rules that we have.
But I'm asking, you said we're going to have something. What is it? Where is it written?
Isn't it a health department rule?
It
order.
But it said, yeah, you wear it, but what are the consequences if I don't? That's what I'm asking. Because we're going to have to deal with that.
Sure. We'll work on that language, Ms. Page.
Is that something that we would need to vote on at our next meeting, Greg, or is that?
I think that, well, you've got two different questions there on that particular piece. One would be whether the failure or refusal to wear a mask as required would violate the student code of conduct and subject the student to discipline. The second would be whether the same thing would constitute
Is Greg freezing up?
Yes, that's why he turned his video off, but I don't think that it helps.
It says the host stopped me. Can you guys hear me?
Yes.
We can hear you. We stopped the video because you were cutting up.
Perfect. Okay. No, not a problem. Can you hear me all right though?
Sorry about that. I didn't mean to.
It popped something up on my screen. I wasn't sure whether I could still be heard. And the same thing would be with regard to employee conduct, although the employee conduct rules are pretty well set by the health department, as you suggest, and so we can enforce those. And if an employee refuses to wear a mask or abide by any other rule that would be required by the health department for us to return to work or by the district, then they would be subject to being written up and disciplined for that. So.
But I just think it needs to be clear. You can't leave it vague because you're asking for trouble. So what happens? I'm an employee. You saw in the coup that took place this past Wednesday, they were trying to get fellow congressmen to take a mask. They said no. And some of the people in that room got sick. So is that fair to them? So what are we going to say?
Okay.
And what about the kids if they say no? What happened?
Helpful is, so it sounds like, so I totally get the question, Ms. Page, is like, what happens if somebody says no and doesn't want to wear a mask? And that's a fair question. Like, what are we going to do? It doesn't sound like we have the appropriate answer now. So instead of debating and trying to figure it out now, I would ask Dr. Miguel to get with Ed and staff to figure out what that looks like and then bring that back to an additional. I think it's a fair question, but I don't think we're going to come up with the answer right now.
We can work with Greg to get the right language in place for students and for employees and bring it to the board.
I think that, go ahead, Janie.
Yeah, bring it back to our next meeting because we've got enough time to get that worked out.
Yeah, right. I mean, the only thing I would say, and again, it's up to the board, but ultimately, but I'm not sure this requires a board level action to decide.
Right. Does it?
So,
okay.
So this is Yolanda. Can I just insert in there? It's bigger than a mask. I think we just, I mean, and I'm not asking for anything to come back to me. I'm okay with whatever the decision is made. It's whatever protocols have been put in place is what happens if a student does not follow those, because there's several protocols that would be put in place.
Yeah.
But all I'm asking, I hear what you're saying, but what is it? It's too big. We get too vague. Too vague, and I know we're not going to do it tonight. But let's be specific. Let's not just say, "Oh, we have a mask policy." Because, like I said, I taught for 30 years. No, no, and a rule. Hey, we got to put some meat into it.
That's exactly what we're saying, Ms. Pages. We're not going to figure it out tonight, but we're going to come back because I agree. Our principals know, our teachers need to know, and so it needs to be clear. So our staff is.
Randy, let me ask Greg. There is precedent. Greg, what did the community college do? They made it clear in written that if a student does not agree to a mask, the faculty can then not allow them in the class. Was that put in a policy or was that put in a practice?
It was a practice. It was a procedure or protocol developed by administration. And by the same token, if an employee refused to put a mask on, they send them home. I mean,
okay. So was that put in? I know we got that letter. Was that just put in as a practice?
Yeah, the administration put that in.
Okay.
Okay. So there's a clear example, not in another country up the road, that faculty at the community college know good and well, I cannot walk in the building. And even if I'm in my office alone, I have to have a mask. And if students refuse to, now we're talking about adults. We're not talking about a third grader. And I'm not going to fight with their third grader. But if they don't wear their mask, they will be removed. Okay, so that's my comment. I have two questions. Oh, Janie, were you finished? I'm sorry.
I'm just going to say, so we have a precedent to work off of. So it's all taken care of.
Yeah, and so I had to ask Greg, otherwise he was going to provide the information. Two, Ms. Rodriguez, I've been trying to find the person. Are you the person that participated in the webinar with the Greater Kansas City Chamber earlier in the year? Or are you not?
No, it was not me.
Okay, so you don't teach kindergarten?
I do not. I'm director of ESL and Migrant Program.
I understand that. So for some reason, we have a kindergarten teacher who participated in that, and either I don't know how to reach out to her, but no one is reaching out to her. She's working with a group that talks about expanding connectivity. So I'm not understanding why one of our staff who was on a public webinar talking about connectivity with other not-for-profits has not been communicated with. Either she's not hearing me or whatever. So that's the comment. No, and sorry, Ms. Rodriguez, you just don't look like the same person. I just was asking. Secondly, and we all received this letter, board members. I do not know if staff received it, but the comments and the letter we received from a member of the public, as well as I received additional letters and phone calls to say that the local health department's attitude in answering my questions were unfortunately rude. And that is unfortunate because they also commented, not in the letter we received, but in other communication, that if, and I apologize to say this but this is what they said. If I had been a white board member from Piper, the Elizabeth woman's attitude would not have been the same. And that was unacceptable. And she was rude and disrespectful. So when you say, if there's something that the health department has historically, they have not been sensitive to the needs of the community of color in Wyandotte County. Hopefully this new regime will be better, but the attitude of Elizabeth's snarkiness does not reflect that. So
Dr.
we
Mann,
received a letter stating that our board members received the letter. So this is nothing new, but the public also needs to know that they also recognized this, their comments. That's all I have to say. Thank you.
Thank you, Dr. Mann. I will just say that I know Dr. Corvo, Dr. Greiner, Julianne. I don't know Elizabeth as well, but I do know that the staff over at the health department have continued to work to make sure that health equity is top of mind and to make sure that their work is professional, respectful, and they work to address the equity issues in our community. So I don't know that it's fair, especially with them not present, to make statements like that. So I understand that.
But you did get a letter. All the board members received a letter. Remember?
That letter. I'll look for it in my email.
Oh yeah, I'm not saying anything that was not relayed to all of us.
But I will just say, I think it's unfair to make those statements without having that person be able to say anything back and in a public forum. And I don't know that has.
No, listen, Mr. Lopez, the public is concerned.
No, the way it was done is very rude, and it should not have.
It is not. I'm making a point.
And it shouldn't be a surprise. And he is the president and has the floor instead of over speaking him.
I'm going to bring us back to the conversation at hand, which had nothing to do with the health department folks because they're not here right now. So I'm going to bring us back to the topic at hand, which is our reentry update. So I do just want to say, out of respect for folks who are not here, I think it's inappropriate to make accusations like that of staff. And we can talk about that, and we can directly talk with Dr. Corvo, Elizabeth, and others to address any issues that we might have. But I'm going to bring us back and center us. Everybody take a deep breath, please. Let's center back on the conversation at hand, which is around our reentry. For our students, we're in charge of their education and their safety and their health. So Dr. Miguel, I have a question regarding the number of students that potentially, based on what was presented today with the K-5, roughly how many students would that be, and staff members back in the buildings? And then two, how many students and how many additional students or how many students are not included in that number? So what are those numbers, if you wouldn't mind sharing that? Thank you.
Sure. Matt, make sure you keep me true to the numbers that we've been crunching. But looking at all of those groups, I think we added a maximum of 1,800 students. Is that correct, Matt?
It's approximately 1,800 students, and that's based on if we selected every student to come in. That doesn't put into account if the parents decided that they wanted to do remote or hybrid yet. And so what we're doing is we're working with principals to really figure out what that number is, how many students at each site we would have. So we can bring those numbers to you on January 26th, so you'd have a better number. Because once we get that number, that's going to really help us determine how many teachers
right, the number of
at the site. So it really depends on how many students. So currently 1,800 is kind of our approximate number for all of those places. And that's majority of those are our elementary sites. Specifically at-risk seniors is about 400 students currently out of all of the high schools.
And Dr. Miguel, my question would be, have we contacted those parents yet to see if they're going to allow their children to come back? Or is that something you'll be doing over the next couple of weeks?
That's something that we're doing over
Yeah.
the next few
Okay.
days.
Yeah.
We haven't contacted them because we wanted to bring this to the board first.
Right.
And also, I'm not sure if my internet is unstable or someone else. Can you guys hear me okay?
You've been cutting out a little bit, but
Yeah, that's what I thought.
So that might vary a little bit. That 1800 might vary a little bit.
absolutely, because what'll happen is even though they may have put that they want to return in person, that's been a minute since we took that information. So as part of the process, once the students are identified by principals, part of that process will be contacting families to determine if they still want to return to school. So we got a few more steps in between, but just wanted to give you all that next phase of students that we'd really like to bring in, but we can get more accurate numbers for you by next board meeting.
Okay, and my next question is, and you may have said it, and it may have just went in one ear and out the other. I'll apologize for that ahead of time. Do we have an idea when we might be vaccinating teachers? Is that sometime maybe the 1st of February?
Well, so the dates that we have, let me bring up that the dates that we proposed, and we did, we proposed the 3 dates for the first dose. That would be January 20th, the 22nd, and the 25th. And then we counted 28 dates for the second dose, and that would be February the 17th, the 19th, and the 22nd. These are not official dates. These are the dates that we sent to the health department with the locations that we are proposing. They are putting, they have a gentleman that works on the logistics of the vaccination. As you remember, they showed us that slide where they showed the Kmart Center and how they prepared it. So Ms. Morris is going to lead the logistics parts for us, and she's in communication with the health department. And we'll have a district committee with the representative from the health department to coordinate all of that.
So it could be, if things go right, we'll keep our fingers crossed and everything, that by the 1st of March, like I said, fingers crossed, our staff may have had both doses of vaccine, and we may not have a lot of the people wanting to still have those accommodations. Some of them may be willing to come back without accommodations, and it might make our staffing a little bit easier, and it may not, and we might have more parents wanting their children to come back to in-person learning.
And that's Ms. Humphries, that's why we were proposing that second phase of a larger number of students for March. This group that we're proposing tonight is these students that up until December 18th, we haven't seen them.
Right.
And so we're very worried. And that's, and when you think about it, in terms of the number of students we have and the number of buildings that we have, 1,800 students is a very manageable number.
Right. It'll give us some practice.
It will give us some practice, and it also gives us room for, we know there are many teachers who are ready to come back.
Many of them.
I think they trust that we are going to take all of the precautions. So it's not that we're throwing them out there to get sick. We are going to be very careful, so they are ready to come back. And then it gives us the opportunity for those who either have health issues or childcare issues to still request those accommodations while we staff these classrooms.
And my last question is, I know the health department is looking for satellite locations to set up immunization clinics. We have a couple of new buildings that have gyms that have isolated access, like Carl Bruce. Have we thought about, or if it's even possible to work with the health department to set up this access facilities?
That's exactly what we're doing, Ms. Humphries. That's what they suggested the Kmart Center because of the size.
Right.
And we wanted to offer 2 of our school district sites and open up the gyms so that people would have choices of location and also of different dates if their schedule doesn't allow.
Yeah, I know that it may not work for them or something, but at least, because Carl Bruce at least is in the Northeast area, maybe people could get to it easier.
Mhm.
Or
I do know, Jamie, that they are looking at, they found a site out west already, and they're looking at a site downtown as well. Part of the issue
Okay.
is about storage of the vaccine.
Right.
It has to be stored at certain temperatures, and staffing. They're already pooling staff to do
Staff.
testing and vaccines at other sites. So it's really whether they actually, can, if they can add other sites. I know there are task force that are looking at that. I belong to a couple of them that are looking at other
Okay.
sites.
I wanted to make sure that we were offering to partner with them.
We're looking at every potential.
Okay, that's fine.
In every location that we can.
And we even requested extended hours so that staff, the majority, all of our teachers are teaching during the day. So a 9 to 3 schedule would not work. So we asked for extended hours in the evening, and they have been very flexible. They were very open to any of our suggestions.
Yeah,
I wanted to make sure that we as a school district were trying to partner in with the UG Health Department as much as we can to help with this.
They're looking at schools, congregations, nonprofits, child.
Okay.
They are looking at every possible option to partner to bring this forward. So I do want to be conscious of time. I know we have a couple.
Well, would the vaccinations be for non-certified staff as well?
Everyone. All.
And then what do you do? And this is an issue because we're dealing with this nationwide. For those minorities who don't feel comfortable with it, because historically, our government, our health department, if you look at what happened in, was it Alabama, Arkansas, and some of the other case studies, I'm just saying some people don't feel comfortable with it. So what are we doing to try to get the word out that this is a good thing?
There are, and I don't know from district standpoint what we're doing, but I do know that, again, from the health department, also from foundations, philanthropy, and at the state level, they are putting a lot of resources into communication, advocacy, education, awareness, marketing, promotion, because of those very same reasons, Ms. Page, you're absolutely right. There is a natural distrust from Black and Brown communities who have been used in the past. And so we need to do a good job of creating awareness and education and making sure that folks understand the need and build the trust. So there are resources being implemented, but I do think there's potential for partnership from the school district to help create some of that awareness locally. So I do have a question, Dr. Miguel, around given the next phase that you all are proposing with that K through 5 group, has there been thought, and I think I heard Mr. Anderson say there has been some conversation around expanding what that would look like if the board wanted to expand that group from just those who haven't attended courses or the seniors who are at risk, or the newcomers. What would that look like? Is there an idea of what that would look like, or does that require further investigation?
So if I hear your question correctly, if we were to bring more kids than we were proposing tonight, then we would go back to the original plan that we had when we thought kids were coming back in January. Remember that we had an AA-BB hybrid plan, and then Wednesdays again. So instead of bringing these students for 4 days all day, we would go back to the original hybrid model.
Okay, thank you.
Mm-hmm.
And I just wanted to say, if we're going to do that, can we work out our kinks? Because there still seems to be some kinks, some things we haven't answered. And if we're going to do it, we want to do it right. That's all I'm saying. Because, we just throw everybody in there and we still got some issues and some things that need to be answered.
Sure.
Well, before we continue to move forward, just any last questions? I know that was a lot of information. Thank you. Really good conversation and discussion, everybody. Any final questions before we move on with the presentation?
No, I just think the final thing is we just want to, and we all want to just do what's right by our students. We know this has been a really, really hard year, and we know there's just been a lot of back and forth conversation. So to the staff, I know it feels like a yo-yo. One day you're going this direction, the next day you're going this direction. We do appreciate everything that you're doing. And just to our public, we just want to do what's right by our students. I know there's a lot, this is a very controversial conversation. So just wanted to say that.
Thank you, Yolanda.
Okay. Say before we move on to the consent agenda, I would just like to ask for, I think there may have been some confusion with our previous presentation around the reentry and the recommendations of the next phase. Could you just maybe provide clarity of what was presented and what we should expect? I think just for staff's sake, for our students and community, I think that would be helpful.
Yes, and that's actually exactly what I was going to ask you. I think there is a little bit of confusion. So I think if we, sorry, oh, I can't see the whole thing here. This is actually what we proposed, which is to bring this number of students who would be most likely up to 1,800 students in K-5, newcomers, the high IEP minutes, those who are in foster care or who have faced homelessness, and those seniors who are at risk of not graduating on time. That was the proposal. And we don't want to confuse people, but I think the clarification I wanted to ask the board, it sounded like there were some questions about could we bring more kids in. So I wanted to ask if that was something that the board wanted us to look at or to do. If not, this is what we are proposing today.
Well, I'm sorry. Matt said at the beginning that this was for information only. So we didn't vote. I just took it as information, and they're going to take it back and come back. That was not clear because he said it was for information. So is it for information?
No, we were not asking for a vote because we were bringing it as an extension of the phase that we have already started. So as you remember, Ms. Page, we started with identifying high needs students back in November, and we identified those special ed students that Dr. Lori shared with us earlier. So when the board decided not to bring students back in January, then we went back to the drawing board to say, we know that ESL students and this group of special ed we identified as needing to come earlier. Now, who are the other students who need to come back earlier? And that's how we created phase 2 of that gradual reentry plan.
But what I'm saying is, he said, and that's why I didn't trip, because he said it's a point of information.
Right.
So we didn't vote.
No, I'm not asking for a vote. I think we were asking to clarify what we are doing. Correct, Mr. Lopez?
So if I understand correctly, yes, I think they're just interpretation, right? I think it was informational in terms of these were the next groupings of small groups of students that were coming in the building. But maybe it would be more clear if we actually, as presented, so that is the next group of students, the K through 5, those groupings that were on there, those who were having trouble connecting, ELL newcomers, so those groups that were presented, perhaps it would make sense if there were a vote to clarify whether that was approved by the board or not, to take any onus off of Dr. Miguel or the cabinet, rather than just an implication that it was presented and not sure what comes next. So,
well, that's why I said we didn't vote. So I assumed it was a point of information.
Right.
Nobody made a recommendation. I understand all that other stuff, but we didn't make it official.
That's why I wanted to come back to, and I think that's why Dr. Miguel wanted to come back to it, because I think there was some confusion in my head whether that was actually going to happen or not. And so I think it makes sense for us to just to let staff know, like, yay or nay. If we don't agree with that, then we need to say no. Or if we do, then I think we should say yes.
Yes.
So
I make a
Okay,
motion.
Dr. Miguel, I would ask you to, as I would respond to what you just said, based on what Tammy just said, there could be the implication that any athlete who was failing, if she was, if what I understood her to say that they need to get back in the building, that'd be one additional group. Am I correct?
That's not what we discussed. What we discussed, and I'm going to share this.
No. I know that's not what you discussed. I'm answering, is that the implication from your question? Would there be additional students?
From my question? I'm not sure I'm following.
Comment. Okay. Did you not just make a comment for clarification? Would there be any additional students?
So that was probably that was probably from me, Dr. Nguyen, because I had asked about the possibility of extending to other students.
Then I'll respond to you then. Based on what Tammy said, any high risk of not progressing would include athletes who are failing, correct? Wouldn't they meet that definition? I think she said yes.
That's a good point. If the athletes are failing, are they going to be brought back in?
They're not K through 5.
I was going to say, according to our current criteria, it would be K-5 students. So no athletes would be considered K-5. You would have your seniors. You may have some seniors that are athletes that qualify, but currently that's not our proposed plan. Our proposed plan to bring secondary students would be in that next phase, start with our K-5 and then bring in the secondary students. If the board would like us to bring in athletes as another group, that's a possibility, but currently we just were focusing on K-5 and seniors.
Okay, thank you.
Sorry for the confusion.
That's a good clarification. Thank you, Dr. Nguyen.
I wanted to make a motion that we accept the proposal so there's no confusion to accept the phase 2 that was presented by Matt.
The motion on the floor, is there a second?
Second.
Moved and seconded to accept the next phase of student return. I don't know that I would call it phase 2. That might create some confusion for folks.
There's a lot of phases right now. So
Do you want me to show the slide again?
To say the next phase as presented in tonight's presentation by Mr. Anderson. Motion and a second. Is there additional clarification comments?
Yeah, I have a comment. We raised some issues, and I hope about the masking and all that stuff is answered in the accommodation, because that's up in the air. And I understand what she said, but you still got to help those principals get those people in and who's coming in, who's not. And for me, I'm voting against it because I think that needs to be answered before we do anything. And I'd like to see it in writing. Like I said, I've been in the district long enough that stuff like that, we leave open, it doesn't always come out the way we say.
Yeah, I think that's something that was discussed that staff will bring back and look at for an example akin to the community college and what they put on paper. So, okay, any other questions or thoughts before we? Ms. Smith, would you do a roll call vote, please?
Yolanda Clark.
Yolanda Clark, yes.
Maxine Drew.
Maxine Drew, yes.
Janie Humphrey.
Janie Humphries, yes.
Randy Lopez.
Randy Lopez, yes.
Wanda Brownlee Page.
No.
Dr. Nguyen.
Dr. Nguyen, yes.
Dr. Yeager.
Yes.
Thank you.
All right. Thank you. And thank you, Dr. Miguel, for bringing that back. And
No
just,
problem.
I think that was helpful for a lot of folks.